Hello, good morning, namaste everyone. This is JD Pasim today, and you're watching WN Talks on Pasim today at 8.8 megahertz. And as well as means we invite always the students and the teachers and the guardians for exploring the education systems in Sudur Pasima. And the same the note we have invited today a very special guest. Our guest name is that Dr. Sweta Bhandari, and she is the daughter of Sudur Pasima, and she has come here for a special like episode, and we just can say that it's like a special appreciation for her. And let's begin like that, inviting her on our show. Welcome to the show.
Thank you so much. Thank you for having me.
How are you feeling today?
I'm feeling great. It feels great to be here.
Okay, as a doctor, yeah.
Yes.
How do you feel as a doctor?
As a doctor, I feel great. The sense of accomplishment that you get from saving the lives, and I think it's amazing to be a doctor.
Most people dream of doctor.
Yes.
Most people just they say doctor is a very high dream, yeah. High job. How is that? What happens when you are a doctor and means when you are thinking to become a doctor?
It just, I think no other job, I know every job is important in its own way, but there's just something about being a doctor. It's more about the people than it's for you. And there's this sense of very fulfillment that you get from helping others and being a part of a lot of things. For example, being in a clinic, talking to the patients, and actually being a part of saving a life, and also a lot of things like delivering a baby, bringing a new human to life and to earth, and being part of these major surgeries. They are they feel pretty great. It's like adventure.
Okay.
Yes.
You're a doctor, you are from Sudur Pasima, yeah?
Yes.
So Sudur Pasima has been always facing a lot of problems, a lot of discriminations. And just let's talk about like menstruation and stigma.
This is something I've always been talking about since I think I was 15-year-old with my family. I've always been trying to make this go away because even when I was a child, it never made any sense to me, like how in such a progressive world today, where we have moved so much with science and researchers, and we're still following the stigma in which the woman has to suffer so much. And we follow it even in my house, and I'm always, especially now that I'm a doctor and I understand how it works, and all the changes that go in our body and all the pain that we go through, I think we should not have to go through the mental, we should not be ruining our mental peace over it, because our body is already going through so much. So I've always wanted this change to be made, especially in our place. Like, I've always grown up outside. I was in India for most of my life, and I've seen all of my friends, none of them had to go through this. Especially when I came home and I had to, it was very tough for me to understand why it is happening. And
again you're facing, yeah?
Yes.
When you're 15 years old, then you have to face,
Yeah.
and miss after become a doctor, you again need to just miss the same problem.
Yes.
Yeah, you just miss went outside, you just had a different experiences, yeah, and you just find there nothing about a life, and like no discrimination there, but everything is very normal there, just means regulated by the science. And again come to home and just find same, my God, I'm back to my 15 years old.
Yes.
Yeah, after a lot of years, yeah.
I know.
So means sometimes we just believe that it's like religious, yeah. So does it have scientific reason to make you out?
I think it started, traditionally, it started because of the hygiene issues and how they wanted to also give rest to the women in those days, because they used to be working all other days in the week. But I think after a while, the concern for the woman changed into something harmful for the woman, as in, especially in villages and in hilly areas. Right now, the woman has to sleep in a different house, which is not really safe. There are so many victims of snake bites, and they catch so many diseases. But I think now the hygiene issue is not a concern, because we have moved so forward with it. So I think right now also following it, I know people have been grown up in a different way. They have been listening to this for their whole life, so they follow it, and I understand it, and I don't expect a sudden big change. It's just a little change towards it, a little effort towards it. Even a small change is a change. So if people could broaden their mind and
Mhm.
try to understand why it is happening
Yeah.
and why they are doing it instead of blindly following it,
Mhm.
I think it would make a
Yeah, you mean to
difference.
say that man, it should be totally stopped.
Yeah.
Yeah, it's totally stopped and like means you guys had to feel very like comfortable situations in your home.
Yes.
Yeah, scientifically there is no reason to make you out, to make you sleep out, yeah, to make you
Yes.
different meal, yeah.
No.
Yeah, so in my like opinion also means so when I see in my villages, yeah, means the should I sono means sitting outside. So what do you think that no, like means God has given them like a 3-4 days. It's a rest, yeah.
Mm.
It's a rest because they are in pain, so they should do something out and they should have the rest. But the society could change that. No, she's a woman and she's like means our sister-in-law. Yeah, she's a Buhari. She has to work. She has to go. Means when you're problem, God has said you just means to be out and to rest. But we are giving a lot of work. You are you're out. You cannot cook. You are out. You do work and you're getting a lot of work on that. It's kind of burden.
Yes.
Yeah, so it should be changed exactly.
Mm.
Yeah. Okay, so let's talk about your like means about history.
Okay.
Yeah. So you're born in Sweta Bhandari.
Yes, I've been born and brought up here.
Uh-huh.
I did
Yeah.
I did my schooling from Emerald in
Yeah,
Vishal
Emerald.
Nagar.
Oh, emerald.
Yes, till class 6, and then 7 and 8 I was in stepping.
Oh, it's stepping stone.
Yes.
Okay, nice.
And then
Then
after that I went to Nainital.
Then after you went to Nainital.
Mhm.
Why Nainital?
Um, it was always my father's dream to send me to Sherwood College. He always, I remember going for trips to Nainital and him showing me the school and being, you have to go there one day. And he wanted to send me there, and I looked forward to it too. I loved the place, so I was looking forward to it. It was great.
Yeah, so didn't you feel sad that means you just left your friends, your teachers here in Nepal, and you just had to go another country, another education where a lots of people so stranger for you. How was the feeling when your parents decided to send you Nainital?
In the start, I was very excited about it. It was something new.
Oh, you're excited.
In the start.
Oh, in the
And
start.
then once I went there, it was really like I was not allowed to call my parents
Really?
for some time. Like we used to have calls only 2 weeks, once in 2 weeks.
Once in 2 weeks, you're going to call the
Parents.
parents.
Yeah.
But what happened when you have like emergencies?
I think for emergency you could go to the teacher and be like you want to call them. But for the first 2 weeks, I could not call my parents.
Oh.
So I was just 13-year-old then.
13
and-
years old, you were
Yes.
Nainital. My God,
Yeah.
you were not mature enough, yeah.
Not at all.
My
So
God.
I was very homesick and I was very scared but I think with time it did toughen me up
Mhm.
and made me more resilient, and I think I did go there as a very shy, introverted person who used to be in her books all the time, but I came out as a very young, confident woman. So
Young,
I
confident.
think it was great overall.
Yes, so means so your parents decided to send you Nainital. Were there some relatives for you?
No, actually it was a boarding school, so it was hostel.
Hostel and boarding, so means your parents just made you very safe.
Yes.
Yeah, it's a safer. You just go and do your educations.
Yes.
Yeah. So okay, miss, what are the challenges that you faced? Just one challenge you just said that means you couldn't call your parents.
Yes.
So what are the challenges that you faced?
The other challenges that I felt there was because I was shy and I was introverted, and I think I was there was a lot of bullying.
Bullying now.
Yes, that happened in my school. So I was homesick and I was alone. But yeah, because I was shy, I was an easy target for the bullies.
Mhm.
So yeah, a lot of bullying happened. So first year was tough.
First
it was very
semester
tough.
for 9th grade or
For
in-
9th grade.
Oh, okay, 9th grade. Yeah.
Yeah, so the 9th grade was really tough, but once I started making friends, I think it got really much better, and
Mhm.
those friends I still have in my life and who became my family because I actually grew up with them. So I'm very thankful for the friends
Okay, when you say that
that
friends,
I made.
friends are important.
Very important.
Yeah, when you have friends, you have no bullying. You have a gang. We say gang, yeah?
Yes, like even if you have bullies, you have the support of them
Yeah,
after
exactly.
that. So
Yeah.
it's always good to have friends. Yes.
Yeah, so I've read somewhere that means as in student life, the 3 pillars work a lot. One is that your parents,
Hmm.
second is the friends,
Yes.
and third one is your teachers.
Yes.
Yeah, so just say that means your parents saying that is one kind of support.
Yes.
Although you just find bullying, when your friends come and the bullying stops, somehow it stops. Yeah.
Yes.
So miss, how do you find like a friend's role in your life?
I think, especially in my life, because I've been away from family so much, the friends have become my family.
Friends have become your family. Yeah.
Yes, and they've played a very important role in my life. Even when I was in Delhi,
Mhm.
the friends from Nainital were very near me, and they're still like I called them yesterday, telling them about this interview, and they're just very important part of my life. I think they
Yeah.
always will be.
Yeah, your friends are
Yes.
very important. Sometimes, as we just say, now, in Nepal, you just say रगत को नाता, अर्को say के भन्छ खून को नाता, रगत को नाता or साथी को नाता, yeah. Some kind of like means a friends relation is very important. Rather than the family too. Yeah, their support is like hidden.
Yes.
Yeah, but the family doesn't see the support of the friends, but friend support is more.
Exactly.
Yeah, so you finish your like a Nainital 9th grade, 10 grade, 11, 12.
Yes.
Yeah, so means, so you choose again like 11 and 10, 11, 12 for the Nainital.
Actually, by class 10, I started making really good friends, and
Mhm.
I actually started liking the place.
Mhm.
So I just continued being there. It started feeling like home then.
Okay, you got a friend, then you thought that no, now मेरे को कभी नहीं जाना. मेरे को कहीं नहीं जाना, बस हो गया.
I want to stay here. Yes.
Yeah, yeah. So which language do you prefer there? Hindi, Nepali, English?
We talked in English.
We
most
talked
of the
English.
times, Yes.
No Hindi there?
No, we did not talk English.
Do you learn Hindi or not in Nainital?
In Nainital, no. In
No?
Nainital, I never talked in Hindi.
Oh
With
my.
my friends, I still talk in only English.
Nainital is in India, yeah?
Yes. But
And you
yeah.
didn't learn Hindi?
I mean, I knew some Hindi when I was in Nepal through movies and
Oh
stuff.
my God. When in Nepal you learn Hindi, when in
Yes.
India you didn't learn Hindi.
No, we hardly talked in Hindi. We were actually not allowed to talk in Hindi. We had to talk in English when we were there.
No, when you're in home, so you can talk, no?
Not really.
Oh my God.
The environment there was in such a way that we always only talked in English. It was normal for us. It
Okay.
didn't feel different.
Yeah, so Nainital is in India. So means, so how many students were there? Means a lot of from India, a lot of from Nepal, from other countries too.
Mostly from India. There were few students from Nepal too.
Nepal.
Yes.
Only 2 countries students.
Yes. Yeah.
Okay. So did you find Nepalese students not there?
I did. Some of my friends were Nepalese.
Okay.
But
Then,
very few, yes.
so when you find Nepalese students, so you feel really comfortable, yes?
Yes, very
So
comfortable.
did you speak Nepali or not?
Yes, obviously. Like whenever I used to be with them, like speaking Nepali felt so good with them
Yeah.
because I wouldn't get to speak it that often.
Uh-huh.
Yes.
Yeah, so English is all the time cause like Nepal families, yeah, something happens.
I miss Nepal so much.
Yeah. Okay. So means you again had to choose like science in the biology, like in the plus 2 levels. So what did you choose? So did you have like becoming a doctor from your childhood, or you just decided in your plus 2 level?
I think since I was a child, my parents always said like she'll become a doctor. It was like a said thing in my whole family. So in the back of my head, I knew I always have to be a doctor,
Mm-hmm.
but I hadn't really decided.
Mhm.
So I chose to be a doctor. I chose biology
Uh-huh.
at that period and thought maybe I'll become a doctor.
Becoming the doctor is your parents like means a dream or your dream first?
First, I think it was my parents,
Mhm.
but as time went on and I started understanding what it means to be a doctor, I think I wanted to be one too.
So means you were comfortable, just means with your parent decisions.
Yes.
So did you have sometime no doctor is very hard, I just like to be, yeah.
Yeah, sometimes like when the exams will be going on, I'll tell my mom, I'll call her and I'll be like, it's very tough, I don't know how to do it. But I think every profession is tough
Yeah.
and you have to go through the struggle. So it was tough, but I think the end result is completely worth it, yes.
Okay.
Yes.
So in the plus 2 you were very confirmed.
Not confirmed about being a doctor as say, but
Mhm.
I was confirmed that I would do something related to the field, something
Mhm.
in the healthcare. Yes.
Okay. In the plus 2 you were still not decided.
Yes.
Okay. So what means the so parents are telling you to become doctor and sending you there, yeah, and investing a lot of money. I just suddenly you say that no, mama, I want to not become a doctor. What would be their reactions?
I think I'm very blessed with really the most supporting parents ever. I'm sure if I told them in plus 2 that I don't want to be a doctor, they would completely support my decision and they would ask me what I want to do. But I was always okay with it, so that was never a problem. Yes.
Okay, let's ask something like a different question.
Okay.
Just understand that you completed plus 2 levels
Yes.
and they dream to make you a doctor,
Mhm.
and you suddenly say no, mama, I don't want to become a doctor.
Yes.
I want to become a CA.
Okay.
And they just say that no, we don't like to support you anymore.
Okay.
there is zero support for you, do whatever you say. So what would you do?
First of all, I can't imagine my parents doing that. They are really the sweetest people ever. And
No, just
if
imagine.
they didn't, okay.
Yeah.
Um, I think I would always try my level best to
Mhm.
make them understand. I think I've always fought for what I believe in.
Mhm.
So I think I would have fought for it, and I don't think I would have done something that I do not believe that I could be good at or
Mhm.
I did not want to.
Okay,
do.
no. Just,
Yes.
just tell me the step by step. I always ask this question.
Okay.
Because it is important to make you ready, yeah?
Yes.
Like when they are like 4 5 class students come here and they
Yes.
just say that I want to become doctor, but they have lots of problem, like financial problem, a lot of
Yes.
like they are good at student,
Mm.
yeah. Their friends say I want to become doctor, they also say I want to become doctor, but they are not sure. They have not like evaluated their like whole careers.
Hmm.
So you need to be ready.
Yes.
Yeah, in the foreign country we are ready all the time.
Yes.
Yeah, so whether in like a 9th grade, 10th grade, you have like a mind, a business mind, entrepreneurship mind. Yeah,
Mm.
so you're very like a means careful about your futures.
Mm.
But we in the country that no, still the parents' support is important for us, and we just
Yes.
means dependent. So my question for that means, as you study in Nagita, in India, what would you do if zero support for you? Okay, just understand you want to choose another subject and then zero support. They have cut off every support for you. What would you do?
Um.
Just don't answer me like you're now a doctor.
Okay.
Just give me the answer. So when were you like that?
When I was in class 11, and
Yeah,
if I
no.
wanted to.
No, you complete class 12.
Okay. After that.
Yeah. After
I
that.
tell my parents I want to switch subjects, and they do not agree with
Yeah,
it.
not 12. Yeah.
Okay. I think, yeah, at that point, maybe I would agree, but I would not be happy with it. But yeah, mostly I would have fought my level best. I'd fight.
You did everything. You did everything and no support.
Okay. Like I would have fought for it, but yeah, I think I would have made a deal with them in a way.
No
I
deal.
could.
No deal. Nothing is there for them.
Okay.
You are just left. They say that be independent yourself.
Okay, be independent yourself. I have to work myself after
Yeah.
class 12. I think I would be able to do it, but being practical at this point that I understand, I don't think after class 12 I'll be able to get a job
Hmm.
which will be enough for me to pay for my college fees.
Uh-huh.
And I don't think I would be able to do that at that point. Yeah.
Okay, fine. Yeah, this is important to understand.
Yes.
At every step of life, I always say to the student that means you need to understand what if your parents stop the support for you.
Mm.
Because same thing happened to me when I completed my plus to my parents said no support, Nabin, no, do yourself. Parent,
Okay.
I came Dangadi myself. I did
Okay.
what I did myself. So that is important. Means to be independent all the time
Mm.
as a child, as a student,
Yes.
because this is important. Yeah.
Mm.
And so means why do I ask like this question? That means till the plus two level, you need to be some kind of independent. You
Yes.
should have like skills to make you independent. Okay,
Mm.
this is important. So how was the journey of MBBS?
It was like a roller coaster ride for sure. I mean, it was like a struggle of studying
Mhm.
and especially like competing with the brightest minds of India.
Yeah.
Yeah, so around I think 3 lakh people give the exam.
3 lakh people give the exam.
Yeah, and
Oh my.
around that only 100 people get selected for it.
3 lakhs per examination and only 100 people.
100 people get seat in AIMS New Delhi.
Okay.
So I was competing with the brightest people, and it was really tough in the start, but I knew that I have to work very hard
Mhm.
to reach the level where I am able to coexist with them.
Mhm.
And it was struggle of study and sleepless nights and a lot of pressure about passing the exams. But I think along with that, the other side of it is I made lifelong friends.
Lifelong
And
friends. Okay.
yes, and I have these unforgettable memories that I
Okay.
wouldn't trade anything for. And I understood a lot about human body.
Okay, let's go a little back.
Yes.
So how was the like entrance preparation? Because entrance preparation is very hard.
Yes.
Now you're competing. You just went to the AIMS, yeah.
Yes.
AIMS is one of the prestigious colleges in India.
Yes.
We can say the biggest one.
Yes.
Like the university and whatever university here is the
Yes.
biggest in India. Whenever
Mm.
people say I'm from AIMS, kind of different kind of proud, yeah.
Yes.
Hey, AIMS, wow. So how was the preparation? Entrance preparation, 3 lakh people are gonna become in 100. How was
Yes.
that?
Actually, I took a year break after
Mhm.
class 12, in which the whole year I did prepare
Mhm.
for the entrance examination, and I was preparing in names
Names,
for
okay.
a while, and then I had to give NEET for this.
Neat, yes.
NEET exam. So I went to Haldwani
Mm-hmm.
for 6 months.
Mhm.
6 months I think I was there, and for 6 months I was in Haldwani, and I was away from everyone in a completely new place with a lot of different people preparing for the exams with me, and yeah, there was like I did not look at anything else for that year. I was only studying, and I had to do it for what I wanted, so I did that. I worked really hard.
Lots of hard work, yeah.
Yes.
Were the sleepless night or not?
There were a lot of them.
How many books were there?
I can't really count them right now. There are a lot of
There are
them.
lots of books, yeah.
Yes.
Lots of books, lots of time.
Yes.
No, time is very short, yeah.
Yes.
When you have to prepare, the time is very short for you.
Exactly,
Yeah,
yes.
and you're just not sleeping, having lots of books. So it
Yes.
means your motivation was great.
Hmm.
It means that you were motivated from your heart.
Yes.
I have to do because my parents, my parents invested, and they really do whatever I wanted, yeah.
Yes.
So my big question is that means you're in India, and just say that you're in Nainital, going Delhi, going Haldwani. Were you alone?
Yes. I was always alone. I think my father always taught me how it's very important to learn how to be independent in how to be on your own when you're in different places. That's very important, and I think I learned that at a very young age. So after Nainital, it wasn't really tough to be alone. I could
Yeah.
do it. Yes.
And the main thing and main motivation for me, also for the people who are understanding, it is a very great. That means a single girl is studying in India and doing hard work and struggling here and there, going here and there, and studying for the MBBS. Yes, is completing. And the main thing is that going alone is not kind of safe in India, I guess.
Yes.
Still, yeah.
Yes.
And so Nepal, a certain place, yeah, it's a distance is very short, so we can be contacted somewhere. But India, going alone here and there, like lots of robbery, lots of rape cases, and lots of things are there. You can feel danger all the time. In the
Yes.
train, you can be kidnapped. In the train, you can be raped. In the train, you can stolen. A lot of things. But going alone through the journey, it is very hard to understand. Yeah, I think you can understand. Your parents can understand.
Yes.
Not other. Yeah. So.
It was difficult, especially the Haldwani part of it.
Uh-huh.
Yeah, it was not. It was safe, but not that safe as much as I wanted it to be. So yeah, going for the coaching early morning at 5 a.m. or so, and just to be dark. So it was scary, but I would always keep my friends with me and try to make it as safe as possible.
Yeah.
But to
Yeah.
have a good coaching centers to learn better, I had to be there. I did not have an
Yeah.
option.
Yeah.
So,
Yeah. So the main thing is that means you didn't have your parents there, yeah.
No.
You need to find the best coaching yourself.
Yeah.
You need to go ahead and then yourself. You need to like travel by the train, I guess.
Yeah.
Yeah, train vehicles yourself. Whatever thing you have to do yourself. So it means that you became a doctor yourself. A kind of independent doctors, yeah.
Yeah, I mean, it is, I think, my parents and me equal parts.
Yeah.
I think if they did not support me enough, I wouldn't be here. So, yes.
How much psychological support is important?
I think that is very important, as any other support. So, yeah, like unless you have the good emotional support from your family, it's very tough to move forward.
Yeah, family is most important when you're alone.
Yes.
Yeah, they say a single word bad for you, you're just heartbroken.
Yes.
Yeah. Hey, you're heartbroken.
Yes.
You're ready to cry. Isn't it? Yeah,
Yes.
psychological support is very much important. Yes, MBBS means people say like, I mean, this is my dream, yeah, and I'll do this one. So means what was the like your parents' reactions when you just passed the examination, the entrance examination? You became the 100 out of the like means 3 lakh people, yes.
Yeah, actually, they were really happy. I think that was one of the happiest moments. I still remember when the result came and we were in our house and my mom started crying when she understood like I'm going to.
You were
Nepal.
in India, or you were here?
I was in Nepal that
You were
time.
in Nepal, okay.
Yeah, I was in Nepal. I was at home and I think it was evening or something and all of us were there. And my dad was so happy. My mom was crying, and it was one of the happiest moment of my life for sure.
Most happiest moment it can be. Yeah.
One of the
One of the most happiest.
moment. Yeah.
Because it's like a dream, yeah.
It is
So after like means becoming rain trans pass, you can do. The journey can be easily going.
Yes.
I know it's not easy, yeah, but for the
Yes.
parents it's easy. For you it's
Yeah.
easy because you somehow like pass one of the gate, yeah. So you are intern. When you're intern, then you have to do. You have no options,
Yes.
isn't it? When you have passed, there no options.
Yes.
Do it, do it, do it.
Yes.
Is it?
Yeah. In the start, like before I joined MBBS, I had no idea how tough is it gonna be. I remember my brother, one of my first cousin brother, he's also a doctor. He did tell me it's going to be very tough and you have to be ready for it. But I was like, how tough can it be? I can do it like that. But once I got into it, I realized it is really tough.
Really
like,
tough.
It is tougher than the entrance. It is tougher than anything. And I could not imagine myself, studying that much and working that hard. But yeah, it is an adventure.
Okay.
Yes.
Let me know why this is tough. What is there? Means main reason of being tough. What is that?
I think it's the amount that you have to study.
Amount
of studying. Yeah.
a
so
lot of things.
from your head to toe, there are like thousands of diseases, and you have to understand the anatomy, the physiology. There's a lot to learn.
Yeah.
Yeah,
So when from one class to 12 class in 1 month is kind of. Is it?
Almost. I think not 1 month, but I think 6 months. Yeah.
A lot of things. Means,
Yeah.
so you remember that means oh my god, एक class दी 12 class मतलब तो यही पढ़ना पड़ेगा. Is it like that?
I mean, we don't really have to study the same thing, but yeah, there's a lot to study.
Lot to study. How many books are there in the first year?
First year, the subjects are just 3 in the first year.
Yeah, 3 subjects.
3 subjects in first year. But they're like different books for it. Like one subject has 3 subparts like that.
Hmm.
Anatomy
Yeah,
has 3.
yeah. So in the university sometimes I miss the suggested book have no in like means in the market in Nepal. I don't know about MBBS. Is I study like I miss master of clinical psychology right now, but we don't have books.
Okay.
We have notes.
Okay.
We have syllabus and we find on the notes.
Okay.
So do you have this kind of also?
Yes, actually, in your first and second year, you're building the base. So at that time, you study from books mainly, and you
Okay.
study a lot. But in your final years, you have notes.
You have notes.
Yeah.
No books.
We have books also, but like for passing the exam, you have to study those notes. You have to remember certain points for sure.
Yeah. Even the first year journey. So what was the first year journey? Because a lot of time we just say first year is very hard.
Yes.
Then after you are going to easy,
Yes.
easy, the bachelor's levels. Yeah.
Yes.
Yeah. So is it the same for you also?
Yes, for me, I think the toughest year I had out of the 5 years I was there was, I think, the first year.
First year very
Yes,
toughest.
very tough, especially because it was very competitive and like our college is said to be the toughest MBBS college
Yeah,
in the whole of India.
Yeah, all of India.
Yeah, so like I was not really prepared for that in the start, I think, but slowly like I understood how it's going to be and yeah.
You were in hostels, yeah?
Yes.
Yeah. You had friends.
Yes, I did.
Friends support you a lot.
I did, yes.
So was it new friends or like the same friend from Nidika?
No. There was no one from Nainital in my college.
Very new.
Yeah, everyone is new.
Again the
Yes.
new life.
Yes.
Yeah. So means somehow means so in a one life, yeah, you had a lot of life.
Yes.
Yeah,
sorry.
we have very new family in the Nainital.
Yeah.
You got again new family in the like means there. Yeah.
Yes.
Yeah, and the toughest moment.
Mm.
And the books can be your new life. Yeah.
Yes.
And new books and new job. Yeah.
Yeah.
So how were the teachers there?
Teachers were really, I think one of the best teachers are there. Like,
Best teachers.
yes, I mean, they're all doctors, the people who teach
Yeah.
us are doctors. And yeah, they're, most of my MBBS life, I think around 1.5 years or so went in COVID.
Corridor.
So it was mostly online classes for that time. But yeah, they were pretty nice and they were very understanding people and they were very motivated to teach us and very into our education. Yes.
Yeah, the teachers' role is very important in your life. Yeah.
Yes.
So first year was very hard, and you in the hostels, and you made new friends,
Yes.
and it was kind of you had to like a sleepless night. So means so why the second year is like a little bit easy for you?
I think for me, the third year was the easiest.
Okay, second year
Yes.
also not.
Second year was also okay. Like I did have to study a lot. It's like for us we have exams almost every 2 to 3 months. But I think third year is comparatively free. There are less exams.
Okay,
in
third year have
years. Yeah.
next examination fine.
Yes, like where I took a lot of trips with my friends and I actually enjoyed the college life a lot that year.
Okay, in third year you thought that this is the college life.
Yes, I mean I did enjoy for second year also. I think I loved my college life. There's nothing I would change about it. I made great friends. I had a great time. I went for a lot of trips. So there was struggle, but there was two sides of it. Like one day I would be like buried in books, and like after a month of the exam, after the exam I'd be in a trip with my friends, or it
Yeah.
was really fun. Yeah, it was good.
Yeah, sometimes like I mean, the people say it's very tough, yeah. Also means do you have time to like visit or like means to go here and there? So do you have time or no all the time? Study.
No, it's not like that. I think one thing about us MBBS students is we have to work very hard. So we have fun also really hard, like a lot. So we take trips and we know how to relax, and we do get time for it. It's possible.
Yeah, you have time too, yes.
Yes.
Yeah, so not kind of all the time, pola, no, like that.
No.
That is important.
Yes, very important.
Yeah, like a lot of people think that no, it's kind of reading a lot of book, yeah, a lot of medicines. So how many diseases you have to read there?
I haven't really counted a lot of it. Just imagine from your head to toe, there are like a lot of diseases.
A lot of disease.
A lot of them, yes.
So a lot of disease, and you have to know here there are like causes, symptoms, yeah, treatment, diagnostic areas, and medicines.
Yes.
Yeah,
Yeah.
a lot of things. Reading all human body.
Yes.
Yeah, when you're reading all human body, you just find that everybody is same.
Yes.
Yeah, is it like?
I mean, it is different in certain way, but there are a lot of similar things
Yeah,
about human bodies.
So, as a counselor, I just find that means
Okay.
we see a lot about the brains.
Okay.
Yeah, brains and our systems, chemistry like that. I just find like means whenever we just see people, I scan. I easily scan that. It's doing like that. And whenever I observe, I just easily understand that the personality of like a human being. So is it the same for you also?
I think brain works in a different way,
Yeah.
so I think it's not the same for me. But yeah, I mean, when it comes to the clinic and I have patients who I have to see, so at that time I do see them as patients and there is similarities between how each symptoms work for patients.
Yeah, exactly, yeah. And when you say that means, so why did I ask like question that whenever we just took like means our patient to the hospital, yeah, they just check one thing and they just said no, this is the disease, and you just do the medicine, and they easily understand and they easily diagnose.
Yes.
And so I sometimes understand that as a psychologist, as a counselor, oh, they scan that this and they know means when the organ are defeated, yeah, and they know that this organ is working with these organs, and it's like called interlinked, yeah.
Yes.
So he's knowing, okay, means if he has a pain here, this pain is from here, and if he get this medicine, then it will be fine. Is it safe?
I mean, there's a lot of causes for the pain to be at that area. It could be referred from a certain place, or there's a lot of things to know in that.
Yeah, a lot of things to know.
Yeah, it's not like because I have a pain here, it's because of this reason.
Okay.
But there are different kinds of pain. Like there's something called a sharp pain, dull pain. So we can guess that this is this.
Okay.
and
You
treat
mean to say that
accordingly.
means as a normal people we cannot guess.
Some things you can, I think.
Okay, a lot of things we cannot guess.
Yes.
We need to leave on the doctors.
Yes.
You are doctor, you do whatever you need.
Yes.
Yeah?
Give it to the doctor. Like, let the doctors treat you.
Oh,
Yes.
okay, so that the doctors are great. Is it? Yeah.
We're okay.
No. So that's why doctors are great, no?
Yeah.
We cannot. No, lots of people they just do that. No, why you take the doctors? See, he has like that, yeah. He has to pay the night, so take a paracetamol. No, he has to do like that. To do something. A lot of people diagnose and they treat themselves. How is it important?
I don't think people should do that on a regular basis. It could be something more than that. A simple headache being treated by paracetamol is okay, but if you're having a headache for a very long period of time and it's unbearable pain, and you should consult a doctor. Don't be ever hesitant to show a doctor. I think it could never harm you. So it's a good thing always.
Yeah, miss my like question is that means a lot of times we have like a G cold at home, like means a paracetamol at home, and the painkiller at home, and like a few medicines are like a pentabry home, and So whenever we have like a few symptoms, we just take this medicine, we will be fine. So is it like good for us or not?
I think it's always best to consult the doctors because they know more about it than anyone else does. So it's always good to consult, I think. But if you're, I think mainly I believe that antibiotics
Mhm.
you should not take it on your own.
Yeah.
That has to be in a prescribed dose,
Yeah.
and you should always go to a doctor before you prescribe antibiotics for sure. Yeah, that I've seen. Like even in my family, they have a doctor in the family, and they still just take antibiotics just like that. And I'm always telling them, consult, like don't do it like that. At least ask me, if not anyone else. So,
Mhm.
yeah, that goes.
Same cases in every family, though they have doctors.
Yes.
Yeah. I had just means heard from a doctor. He just said me like that means so in my family there was like a cerebral problem.
Okay.
I was treating, I was diagnosing, and so she's not becoming fine. So he isn't really fine. So I went doctor and I just asked that, okay, what is the problem? He just say, "Ghar ki murgi dal barabar." Yeah, ghar ki murgi dal. You're a counselor and you can't counsel your family.
No, don't pass it.
No, means I just found like a very tricky question. That means he just said, if you are a counselor, you can't do the counseling to your family.
Okay.
I am a doctor. My wife doesn't listen to me, though I am a doctor. What is this?
I don't know how that happens. Like,
Does it
I
happen?
think
Does it happen with you or not?
it does.
Yeah,
happen,
yeah.
yes,
This is my
it
same
does.
question. That means though you are a doctor, though you are a doctor, the people will less have the consult with you,
Yeah.
and though as a counselor, they have less counseling for me. Why this? What do you think this? What is your view on that?
I think our parents have seen us grow up, and I think it's very difficult for them to see us as a professional.
Mhm.
We're still their kids.
Yeah.
We're a child for them. So yeah, I think my parents do believe when
Mhm.
it comes to important things, but normal things, if my mom is having some pain and I'm telling her to take this medicine, she'll just be very doubtful always. She's like, are you sure? Like, yeah, that happened yesterday itself. So it's like a day-to-day thing. But when it comes to important things, I
Mhm.
think they do believe sometimes.
Yeah, exactly.
Yeah.
When there is a very important thing, they believe. Otherwise,
Yeah. They're like-
they just talking lightly, halke
Yeah.
mein.
Yeah.
Yeah, hey, क्या doctor करती है? चुप लग.
Yeah.
Yeah, same for me. खूब counsel, just चुप लग. तेरा counsel काम कर देना.
That's it.
Yeah, it happens everywhere.
Mhm.
Okay, now I'm very happy because I knew that means everybody said.
Mm.
Yeah.
True
So
that.
does it happen only in Nepal or in India? You been in India a lot.
Yeah, it happens in India also, I think.
Okay, it happens all over the world.
Yes.
Let's leave it.
It's everywhere.
Okay,
Yeah.
means when you're a doctor, your family is listening less to you. Other people is going to listen to you.
Yes.
And when any profession they have, like same with the teachers also, yeah.
Mm.
Means I just find like many teachers at home,
Mm.
and they're going to teach the students, children, they listen less.
Mm.
Hey, mummy, to nahi kaise pade. Yes, when they go to the schools and they understand a lot.
Okay.
It happens. Okay, fine. Yeah. So let's ask like another question. That means so when you're a busy doctor, they give very less time. It's big problems.
Mm.
I go to the doctor.
Yes.
Yeah. I like to pay use fees. Yeah, for the like OPD charges,
Yes.
and I go there and he gives me very much like very less time for me. Why this happens? As a doctor, what do you say?
One thing I actually did not like very much when I was posted in village Balabkar in India for 3 months, and I had to see patients there. And I think one of the main reason for this is the less number of doctors and a huge number of patients.
Less-
Patient to doctor ratio is really bad. So because of that, even if a doctor wants to give time to a patient, they cannot because
Yeah.
there are a lot of patients. They're coming in bulk, and especially in government hospitals,
Yeah,
we hardly get time. Still, I used to try my best to give time to the patients, and I used to try that. But I think we need to increase the number of doctors for this problem to decrease.
Yeah. I think like Miss Doctor's number won't be increased till the world dies. because like as you increase the doctor's number, just under that means in the India, or just understand why can't we increase the doctor's number? I give a clear examination because there were 3 lakhs people for the entrance examination and 100 for the seat. Yeah. What happened is that 2 lakh seat.
No, actually, there are a lot of medical colleges there. So
Uh-huh.
if the people who did not get an AIM study, they can get in other aims.
No. My question that is why there is no 2 lakh seats.
Okay.
Yeah, if there is 2 lakh seats, the doctor number could increase now, yeah.
Yes.
So that the people get. Means so I understand that means why people are getting become patient more by more is that because the doctor isn't giving time.
Yes.
Yeah, I just go to hospital. I just say I have problem. He talks and just say do the X-ray, and you just see the X-ray. Then he say do the medicines, and the medicine doesn't work. Yeah, so I always tell doctor that give enough time. Yeah, because I just say that okay, because okay, I have pain here, and please check it. Please do all the diagnose. Yeah, do the radio X-ray, do the X-ray, do everything. And my question that means you are doctors, you have done MBBS, you have done MD, you are a specialist. My like always belief is that means if I visit you, if I visit you, don't let me allow to visit another doctors. That is my only one concern.
I think that's very important to give time
Yeah,
to patients.
yeah, that is very important. Like, isn't it? Means if like a private hospital, we invest a lot of money, and you have done MBBS, you have done MD, you are a specialist. I know you are very specialist, but means I have a doubt on your specialist. I am visiting another doctor, thinking that you are not good at.
Yes.
Actually, he is good at. But the main thing is that means I am being transferred. That means he hasn't given me time.
Yes.
Is it like that?
I mean, I told you before, the ratio is actually a big problem. But yeah, I think it's very important to give time to the patients. I personally believe in it. Especially, I went to the US recently last year and for my clinical rotation. So one thing I noticed there that was so different and I liked so much about it was I used to spend 1 hour with one patient. I would
1
talk
hour with
one
one
hour
person.
with one
Yeah,
patient. So like because there were lesser patients, you know, a doctor could do that. And I think every doctor does enjoy spending time with the patient
Yeah.
and understanding them and understanding their problem, building the rapport. I think it's a very fulfillment kind of
Yeah.
feeling when you have a good interaction with the patient and the rapport that you build up. And I really enjoyed my time there because I got time to understand the disease very well and the patient too.
Yeah,
So
that's
great.
that is important. That's
Yeah, I
great.
think that's very important.
Yeah, spending
yes.
time. Yeah. So I understand that means so as a counselor also we have like a lot of questions about like a family, about your history, yeah,
Yes.
about the situations, about the situations at your family, when you have pain on your like eyes, why that happened. So does it like a genetic problem or not, biological problem? So does your father have or not? Or the situation at your home? Is somebody giving pain or not? Is somebody like a beating or not? Like means is the whole situations? How many people living in your family? We ask a lot of questions. Then we understand the problem.
Yes.
But when you go doctor, oh you have pain here, okay, take medicine, go. क्या किया तुमने? Isn't it? Yeah, yes. So that is very important, and to understand that means give a time to the patient. And the same thing is to say that less numbers. And my question that if there are less number, increase the more seats.
Exactly. I think there have been a lot of government schools, medical schools that are being built, but I think the number needs to increase even more now.
Yeah, yeah. That is.
It's important to have more doctors for the country.
Yeah, yeah. The main thing is that means if we have more doctors, we can get more time. Then we can be fit and fine. Yeah, it's good for everyone, no? Yeah. So that is important. Okay, now we are flying USA very soon.
Yes.
Yeah. USA is also dream. You are like living in the dream, yeah. Yeah. So means become a doctor was a dream. You became a doctor,
Yes.
and you are going USA, and you already been for 2-3 months in the USA already. So how is USA? Why USA is dream for me, please?
I don't know about everyone, but for me, especially, it's that when I wasn't very sure I want to go to USA. Like after MBBS, I was not really sure where I want to do my post graduation from. But when I went to the US, I wanted to see how is it like, how are the how are the hospitals, and if I'm going to like the way. But I went there, and I told you right now that spending so much time with the patients, and I saw my doctors having such good relationship with the patients, you know, they loved their patients and the patients loved the doctors. And I remember the patients going for trips and they bringing them small souvenirs and remembering them in the trips, and they used to hug their patients, and like it was so good, and and I loved that about it, and that was one thing that motivated me a lot to go there. I wanted to have that kind of rapport with the patients.
Wow, that's important. Means I found when they hug the patient, this is very important. Yeah, I understand. Means very soon I watched the video that means like Stephen Hawking and like Miss Bruce Lee has -10 eyes, and like Stephen Hawking was like that. A lot of people's, and they were about to die. Means as a doctor, if you diagnose, they are very unable, they will die. But means the world has given so much love and so much blessing, so they are living. That's important. Okay, now we have going to another break. The break is for that means to everyone who are watching to us and listening to us, we are going to read your comments, and I am just asking Miss Dr. Sweta Bhandari to reply, to give like views, and to do something with your comments. And so I'm going to read the comments, and means whatever comments you like to drop for us, and we're going to read it. Okay, there's few comments.
Okay.
You just read it,
Okay.
or I will read it, and you just means reply to them.
Okay.
Okay. The comments like means Dana Rosada. Do you know her?
Yeah, she's my mom's friend.
Yeah, she has sent the love. What would you like to say to her?
Oh, I'll say thank you so much. It's very
Oh.
sweet.
Lakshmi Bhandari is writing Choro. Are you Choro or Chori?
Sure. That's out of love, I think.
What would you like to say to her?
Oh, I love you. Thank you for
Another same.
everything.
Yeah, Nanu, we are watching your interview. Nanu, we are watching your interview. Lakshmi Bhandari, right?
Yeah, that's my mom.
Oh, what would you like to say to her again?
I'd like to say thank you so much. I love
Okay.
you. Yes.
Bhavan Bhatta, I guess. Wow, it's a great and very proud moment for you and for family. Love, 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 love.
Thank you so much.
Do you know him or not?
No.
Okay. Namraz BK, right? The great work, brother, is for me. I would like to say.
He is doing a great work.
There are more comment, but I don't know. I am unable to read it. They are like, okay. Pushpa Bhatta is watching.
Okay.
I would like to say to her.
Thank you so much for watching.
Okay, there are like means more comments, but like when you're live, so it's hard to read all the comments, I guess.
Okay.
Let me. Okay, yeah, there you can see. Sis Bhandari writes love, love. He sends love signs. What do you have to
That's
say?
my brother.
What do you have to say to him?
I love you so much.
Okay.
Thank you. Yes.
On this day, it's a great and proud moment to have seen you in media about your own what is the experience?
I
Like,
think he meant your experience. Thank you so much, uncle.
is your uncle?
Yes.
Parkas Bhatta says, Bhanji, I'm watching your interview from Jury Swiss Airport. Keep rocking.
I'd like to say thank you so much for watching, Mama.
My,
It's
he's
very
busy.
sweet.
He's busy. Yeah, he's still watching. My so much love.
I know.
Nirmala Bhandari, proud of your sister.
Thank you, sister.
Meera Bhatta, wow, great Bhanji, love, clap, love, smile, wow.
Oh, thank you so much, Maiju. Thank you so
Now you
much.
read yourself.
Oh, that's my Fupu.
Ah.
God bless you, Nana. Thank you, Fupu.
No, name her so that she can
Oh,
know.
Sushma Ocha.
के हुन्छ भने they say
हजुर।
मेरो नाम पार्यो भन्ने हुन्छ नि।
Yes.
Okay.
Thank you, Fupu. Thank you so much.
Rajesh Bhandari, who is he?
My father.
How
Thank
did-
you, Baba.
Read the comment.
Rajesh Bhandari, great, proud of you. Thank you so much. Love
Okay,
you.
another one.
Again, he likes my great Bhanji. I like your answers, Prakash Bhatta.
Okay.
Thank you so much, Mama.
Okay, now I read, okay?
Okay.
Rajesh Bhandari, wow.
Thank you, Baba.
Okay, Indra Dhami, very nice story, yes.
Thank you, Auntie.
Okay, my lots of love for you, yes.
Yes.
Indra Dhami, excellent, my daughter, and love for you.
Thank you so much.
Anjali Gautam, love for you.
Thank you, Anjali.
Rekha Pand, very nice, proud of you, Nanu, yes.
Thank you. Thank you.
Rekha Pand, do you know or not?
Bauju. Thank you,
Okay,
Bauju.
Radhika Rawal, Nanu, I send you kisses.
Kisses for you.
Okay, Lakshmi Bhandari, Choro, again she writes Choro. Oh, they want to see Choro like you or not?
Huh?
They are giving like you are a Choro, not Chori.
They just say it out of love. I think choro, chori, anything they
Oh.
just say. Like
Oh.
I call my mummy Momo.
Momo. Oh.
Sometimes out of love, yes.
Momo is a love or Momo is like teasing?
No, not teasing at all. Just
No, Momo is different. No.
Not like that. It's mummy, Momo.
No,
I call
Mom-
her everything.
Mom is like Golu Modo kind of Momo.
Not really that. Don't tell that. She'll be mad at me outside.
Oh, sorry about that. Okay,
Yes.
now we're about to end the interview,
Okay.
and like a few questions have like an instrument here. Okay, so my few questions, which are open-minded questions, you give me the answer within one word.
Okay.
One word, just we can use the two words.
Okay.
Why MD is important?
NG.
Yeah.
To be better at what you're doing, to specialize, and to be able to treat better.
Okay.
Yes.
Why parents' love is important?
It's everything.
It's everything.
Yes.
Why teachers like MS counseling is important?
It helps you build your base
Mhm.
and helps you learn a lot of things. Having a good teacher very important. Yes.
How do you find peers support in one word? One word, just one word.
Family.
Family. Great. Okay, what is your favorite pet animal?
A dog.
Oh, dog, yeah?
Yes.
Favorite color?
I think blue.
Favorite place, India, America, or Nepal?
Nepal for sure.
Nepal for sure. Okay, you're going USA very soon.
Yes, but yeah, in the long-term plan, I'll probably come back. So
Okay,
yes.
long-term plan, probably come back again.
Yes.
Come back again means you are going to do some contribution in Sweta Pasim again.
I will.
Great, this is important.
Yes.
I appreciate that. When you say I will come back and I will do, this is very important.
Yes.
Yes. Okay, what will you do after coming to Nepal?
Right now, I don't really have a plan, but probably treat patients
Okay,
and
three sentences you can say.
okay.
What will you do after coming to Nepal?
Make the healthcare system better
Mental health is how?
by having like clinics and
Having
treating the
clinics?
patients. And
Having clinics means you will build clinics.
yes, probably.
You will build clinics means you will build a new clinics.
Yeah.
And you will do?
I will treat the patients and I'll try to make healthcare as good as I can at
Okay.
that point with all the
One-
skills that I have.
Okay,
yes.
fine. That is one. And two?
Yes.
What is two?
Okay, do with the what would I do? I would uh, I would yes, I think as a doctor with the speciality that I have, that the skills that I learned from there, I think I could be able to bring new technologies, especially like
Right.
my plan is to be a surgeon in the long term.
Be a surgeon.
Yes.
Cutting.
Yes. Surgeon. So
Yeah.
maybe bring more new technologies from US to here. Yes.
Surgeon for what?
Right now, I think it will be for surgery for 3 years, and
No,
then
surgeon in mind or surgeon
oh, of I think gastro.
gastrologist.
Yes, gastrology.
Fine, okay.
Gastroenterology.
Third point.
Yes. Okay. Third point. I would after that I would also try to have at least once a week free clinics
Once
for
a free clinic.
for the people who cannot afford it, and I would like to do that. I'm not sure, like I don't
No,
think
it's free,
I think
no.
it's like 15 years from now, I'm sure I'll be more mature and I'll be able to do better, like think better then, but
Oh.
as of now,
Now, when you say
Yes.
free, is it possible?
I think once a week it's possible.
No. If this is free, just understand as a me,
Yeah.
as a greedy person, the 6th day I will not come to your hospital. When you say free, chal bhai, ab to chale.
I'll come back to Sudarshan when I'm financially independent. So I don't think I'll be doing this for money when I
Mhm.
come here. So it'll be mostly
Yeah,
for
free,
helping the
free
patients.
for certain cases, I guess.
Yeah.
Yeah, that is important. As a doctor, as a, like a means suggestion that can be free
Yes.
for some things.
Yes.
Because if you say free, we will not come for the 6 days. Hey, abhi nahi jana bas. This दिन free बोले तब चलो. Okay.
Okay.
Thank you so much for coming to our show.
Okay. Thank you so much for having me.
We are very glad to make you invited here. And thank you so much. Let me whoever supported you through your whole life, yeah,
Yes.
to make you a very successful doctor, successful daughter, successful daughter of Sudhir Pasima. Thank you so much. And we were getting the support from our Sediana brother. He's a very handsome man. And thank you so much for watching Radio Pasim today, 88.8 MHz with Nabin Parki. Thank you so much. Today we had Dr. Sweta Bhandari. And thank you so much for watching to the show.
Thank you so much.
Bye. Bye bye everyone. Bye bye. Thank you so much for watching to us.